lowest bed, and we have the highest patient satisfaction rate of the patients in the emergency room. We rank in the top 25% in Canada in terms of surgical safety. We also rank highly in terms of, we're tops at Fraser Health also in terms of medical safety that just came out this month. So Delta is a great hospital, and that's point number one. Point number two, we're being vastly underserved. We sent a letter to the minister back in October because talking to my colleagues, they expressed to me that they were very concerned about the surgical program at Delta. They were getting cuts every year. They wanted to shut down the OR for 2 weeks at a time, 3 weeks at a time, and anesthetists were worried that they were not able to recruit any more and any new colleagues to keep the hospital going.
But to come back to that sort of stage, you can't just say, we'll do it tomorrow. You need to take the steps that are required, and this takes some time. And we've approached the Fraser Health, as Dr. Hornstein alluded to, and we've approached them to say, we need a plan. We need to think about where we're going to be in the future. What are the steps? Where do we start? And starting with a limited amount or a limited approach to inpatient surgery is a good approach. It's a logical, it's a thoughtful, and systematic way to approach it. And I think when we met with them, they were quite appreciative of the fact that we were thinking about how we're doing it. We're not just asking and asking. We're asking for things that are appropriate for a community of this size and asking in a thoughtful and logical manner.
We were told early on that nothing's going to happen at Delta Hospital without political pressure. And we said, okay, we know how to get political pressure. And so everybody's here, and I thank you all for coming again. I want to thank Vicki Huntington and Scott Hamilton and all our other guests, Doug Massey, for coming out today. And we really appreciate the support you're giving for Delta Hospital.